Basically, about 2.5 months ago, I couldn't see clearly out of one eye. And within the MRI, they found that my optic nerve was being attacked. The literal word I was told was, "Your world is about to change."
These fine folks at MIT and Harvard have just published in Cell its single injection therapy, and it corrects the DNA.
Surgeon claims he's ready to do the world's first ever human head transplant. Sounds like the movie Get Out almost.
This is called Liz. It's new tech that's come out that promises to know you inside and out.
I wanted to talk about BCI, which are brain-computer interfaces. Some people really see it as a key element of healthcare and just technology in general in the future. What's up, brain fans? I'm Ovi, and welcome to the Neuro Bros. My partner Abhi and I are two double board-certified neurologists on a mission to make neuroscience as addictive as your favorite Netflix show.
Every episode, we're diving into the fascinating world where your brain meets cutting-edge technology, where medical breakthroughs happen in real time, and where the most complex organ in your body becomes actually pretty relatable. We're talking everything from migraines to consciousness, brain fog to AI, patient stories to the latest in research that's changing everything.
So whether you're a medical professional, patient, just curious, or just want to understand the 3 pounds of genius between your ears, please follow, like, comment, share, and join the Neuro Bros family. We're going to be going through a couple segments today. The first one that we have to share with you is pretty special. We have a guest coming in to speak with us. His name is Rajjat Nibber, but I'll let him introduce himself and give us a little bit of context about why he's joining the show.
Hi, guys. I'm Rajjat Nibber. I'm here because Abhi and I have been in touch, and I recently randomly got diagnosed with multiple sclerosis. And I'm here to share my journey about that and my experience with my doctors, my insurance, and the whole journey.
Thank you so much for coming on the show, Rajjat. Multiple sclerosis, that's a pretty scary term when you throw it out there. Can you educate us a little bit? What is MS? What does that feel like? What happened to you?
I've actually had to learn a lot about it in the last 2 months. I've had a crash course on it. Basically, about 2.5 months ago, I woke up one day and I couldn't see clearly out of one eye. I was having double vision, and at first I thought it was just my prescription. I didn't think much of it and went to my eye doctor, realized there's no structural issue. And then as I went through my diagnosis journey, I had to push for my ophthalmologist to prescribe an MRI. And within the MRI, they found that my optic nerve was being attacked. And once that was discovered, that the literal word I was told was, "Your world is about to change." And that was pretty scary. But as I went through my journey, I then got hospitalized. I went to 3 days of steroids and further testing. And they ended up finding additional lesions, additional areas where my nerves were being attacked. My myelin sheath around my nerves were being attacked. They found 15 to 20 spots in the brain and some additional spots in the spine as well. And from my understanding, it's not multiple sclerosis unless there's multiple areas of attack happening by your immune system. And so that's pretty much why or how I got diagnosed and how I discovered this. If I didn't have that vision change as a symptom of mine, I likely would not have noticed that I was being attacked in these other areas. So luckily for me, I did get to see literally by symptom. But I've heard some folks won't get symptoms like that. And the 15 to 20 spots in the brain were likely there for a while. So this has been going on for some time. Only did the vision change let me know that there was something serious going on.
You had what we call the classic optic neuritis, and that's the term we use for that eye inflammation for MS. And yeah, you're right. So they use that term, multiple sclerosis. It just means multiple scars. And you need different ones in time and place. So, different periods of your life and different parts of your brain and your central nervous system finding scars. And 15 to 20 lesions is quite a heavy burden already. So I understand your concern around this diagnosis. How did it make you feel when you kind of learned all this info and they started dropping it all onto you? It can be really scary in the medical setting. I understand a lot of the objective stuff you've told us, but how are you feeling through this process?
I think the day one diagnosis was probably the scariest feeling I've had. my wife and I, we've been trying to have kids. We want to start a family, and literally my life was flashing before my eyes. I didn't know too much about this condition. And so the way I was told was a little scarier than now how I feel about it. It is still a very scary diagnosis. It's very uncertain. The uncertainty of the diagnosis and what symptom could be next or what area of my nervous system could be attacked next is probably the scariest part of this. But I have understood that there are disease modifying therapies. There's things that I could do on my own to build some neuroplasty, learning new skills, things like that, a better diet. It's almost been a wake up call. I was maybe partying too much a little bit here and there. And I've kind of just like reined everything back in and slowed down. One of the wake up calls that told my body, hey, just slow down. Like, this is serious. Let's get you treated. Let's eat better and ensure that you are doing all the other right things, that something else doesn't exacerbate this condition. I think one of the jokes I tell my wife is that now I realize why I forget things so much. So she gets mad at me and I'm like, well, there's 15 to 20 spots.
You got the excuse now. You got a good excuse now.
Yeah, I use the MS card a little too much sometimes around the house, but yeah, that's kind of like it's still scary. The uncertainty is the scariest part. I'll wake up one day and I'll feel like a neck pain. And I don't know if that's related, and I don't know if that I should take that more seriously. I've been chatting with Abhi about this actually. The headaches that come with this, with double vision, there's almost a headache every day just because I'm still not 100% back in this eye, maybe 94%, around there. My colors are still different in one eye versus the other eye. And so that leads to continuous headaches. And I'm like waiting to get treated so I can realize if this is going to be forever headaches, or is it something until I get disease modifying therapy and it slows down. But the uncertainty and the randomness of this disease is the scariest part. But I'm trying to operate in in Sikh saying there, it's called Chardi Kala. It's like be positive in every situation. That's been my mindset. So I'm hoping to keep that mindset as long as I can.
What was that phrase? I love that.
Chardi Kala. It means high spirits, like always high spirits in terms of times of adversity, times of good times as well. Just always stay in high spirits.
So let me get this right, Rajat. So you're saying that you had 15 to 20 spots that, you may have brushed off, may not have really felt. And then you finally had one that took away portions of your vision. You got hospitalized, and now you're still waiting for therapy? How long has it been?
This is the third month now. So I was told that we should start getting the treatment going as soon as possible. So the first 2 or 3 weeks when I met with my MS specialist was to identify what treatment I'm looking to get. And once I decided which one made the most sense for me, and with 15 to 20 lesions in the brain, 1 in the spine, 1 in the optic nerve, I went for the higher efficacy treatment options. But since that process, I've kind of just been at the mercy of the insurance companies figuring their stuff out, and then the doctor and then the infusion center also working to kind of get my treatment started. I did have a setback in that. I got word from my infusion center, of all places, not my doctor, not my insurance company. The infusion center told me that my insurance company had denied my treatment claim.
Let me get this straight, Rajat. So you went to your doctor right after you got hospitalized, a specialist in neurology, a specialist in MS. They laid out the exact therapy so that you wouldn't wake up with more blindness. You wouldn't end up in a wheelchair. You would get what you needed. They sent it to your insurance, and for 3 months, they have continually denied your medication?
Yeah. I'm a little bit blind about it, but that's the latest I know. I got a text from my infusion center and my doctor's office, both of them saying that, hey, yeah, the insurance has denied your claim to get this treatment. We are going to appeal it. I don't know why it was denied. I don't know who reviewed the claim itself to deny it. It seems like a pretty clear-cut case to get something of a higher efficacy, because that's what it seems like to me as like a non-medical professional. Now, I also don't know what the next steps are. I followed up with my doctor yesterday to see if there's been any movement in my treatment. I don't even know. I haven't even gotten any notice of alternate treatment options. It was just straight denial of the treatment. And so now when I wake up and I have a little bit of a neck pain, I'm like 3 months out from my initial diagnosis. It's a little worrying where I don't know what my next step is. I'm waiting.
That's absolutely insane, Rajat. Just insane that you're having to deal with that. And we apologize, on behalf of the whole healthcare community. And it's unfortunately something that doctors and patients go through on a daily basis, getting permission from probably non-medically trained insurance people for medications that they urgently need. And that's the scary part about MS. It's called relapsing remitting multiple sclerosis, because you can have a new relapse that can really set you back in terms of your level of disability. And you can have inflammatory flares and non-inflammatory flares. And so you can have chronic symptoms like back pain, neck pain, headaches that are really the results of the previous damage. And then you can have a new episode of your immune system attacking your nervous system. And that's really what we want to prevent, is further damage and further degradation to the nervous system. And with 20 to 30 flares, how old are you, Rajat? I don't know if you don't mind me asking.
I'm turning 36.
Yeah. You're young, and that's a lot of lesions already. You really are in a fight against time to try to maintain your level of ability and prevent further damage to your nervous system. So at least offering, there are other drugs that you can use that are less efficacy. That's not ideal for you. Anytime it's brain and spinal cord, you got to go for the high efficacy drugs. I mean, that's part of the guidelines. That's taught. That's pretty standard of care. And we used to get people approved for it all the time. So I apologize you're going through the delay. It's got to be frustrating for you and your family.
Let me just make a point here. So we've known about the need for high efficacy therapy for patients with spinal cord lesions from MS for half a decade. There's been medications, there's been efficacy, there's been proof that if you have what Rajat has, you need to be on this therapy. That's understood by every neurologist, every MS specialist, and that's why it was prescribed to you. It was prescribed so that you could not end up getting disabled. Let me ask you this, Rajat. Who pays the price if tomorrow that neck pain turns into paralysis? If tomorrow you can no longer use your right arm, who pays that price?
I mean, that's going to be for me to live with for the rest of my life at that point. Me and my family, like it's unsettling to know that that's a possible reality. And I'm just sitting here waiting for everyone to figure their things out. So I'm doing my part to follow up as much as I can, diet, exercise as much as I can, but I know I need the treatment. That's the hardest part, is I know I need something else that is out of my hands at this point. And I've been with this insurance company for 7 to 8 years now. I've been contributing to my insurance for the entire time. And it's just unsettling not knowing what my other options are. And I'm just sitting here waiting. I don't even know why it was denied. It would be nice to know why.
So 8 years you've been paying into the insurance, right? Have you ever missed a payment?
No.
Ever been delinquent on any claims?
Nope.
And when you actually get sick, when you end up with the disease, and thankfully it has treatment, what does insurance do for you? It disappears.
Yeah. It's been, so my denial was, I think, the first week of August. Now we're 4 weeks after that, and I haven't gotten any additional information. I've gotten a few phone calls about, hey, we can provide mental health, like counseling if you need it. I'm in my head, I'm thinking I need something else. I need the disease modifying therapy.
That is so insulting, to just offer you mental health support when you have a neurodegenerative disease that needs urgent treatment. Just so insulting.
I mean, that's like me shedding the light of, like, there is a good side of this, but like the real crux of it is I need to get treated. Great. You have mental health facilities. Great. You have dietitians. I would like to know what's more important to me is knowing why I got denied. What's an alternative option that I could have gone with that wouldn't have been denied? And then what the timeline is for me to get this appeal finished or done, and then get my treatment started. Because every day when I wake up with a new thing, new feeling, I'm thinking, could this be something that's bigger? And luckily, knock on wood, nothing has been bigger. I live with the headaches, I live with the neck pain, and I could get through my day like that. But like Abhi said, if I wake up one day and my entire left side goes weak, I'm paying that price. I'm just because the insurance companies couldn't figure out why I need this treatment. Like, it's a little crazy to think about.
Yeah, and you're not a physician, so you don't have the the insights into the struggle that we have with the insurance companies. And I'll give you a little bit of insight since you've come on the show and you've asked good questions. Why am I getting denied? The short answer is money. The therapies from, years and years ago are cheaper than the new age therapies. Those therapies can be effective in about a 30% reduction in your chances of MS and of MS flare. And that would be appropriate for somebody with a couple flares here and there, none in the spine, low disability and otherwise healthy. That would be fine. There's a lot of data that shows that when you have what you have, Rajat, when you have disabling lesions throughout the brain and the spine, that's not going to cut it. The cheap meds will never cut it. You need to be on the higher efficacy new age therapies that have a 70 to 80% reduction in flares annually, right? Let me ask you this. If you were in a position of power where you could talk to somebody at the insurance company and you could tell them, hey, listen, I am just like you. I am just another person trying to get through the day. What would you tell them right now?
I would tell them there's zero reason for me to be denied. This claim, exactly what you just shared with me, has been what I've been told by my MS specialist. Where if my disease has progressed to these 15 to 20 in the brain, a couple in the spine, optic nerve neuritis, there's clearly an attack going on. My immune system is fighting. I'm not, I guess, exhibiting every symptom that's been in the brain, as far as I can tell. When I feel something or when I think about the past, I can almost remember the moments that might have been an episode. And now I don't want those to increase. I mentioned earlier, my wife and I are trying to start a family. I'm going to have kids eventually. And I don't want to be disabled when I have kids. I don't want to have to raise my kids while I'm in a wheelchair. That's the scariest thing for me, for living a pretty healthy life for 35 years and then finding this out. I would tell them that I'm just like you. I need this treatment. And there's my doctor, who is an MS specialist at Johns Hopkins, prescribed me with this treatment. She told me that this is the best option for me to live a viable life and a healthy life going forward without additional damage. It almost seems like the insurance companies want to see me a little worse so that I can get treated. And it makes sense to them if I'm a little bit worse. And in my head, I'm thinking, I'm good right now. I'm healthy enough right now. I have some vision issues. I have these existing issues, but I don't want to get worse to get treated with a better treatment, which, again, like you mentioned, if it's in 3 places, I'm like racing against time right now. And so that would be great if they just like reviewed my documents with my doctor and reviewed my case with my doctor or an MS specialist, because I don't think an MS specialist would deny my claim for this treatment. And I wonder who did.
I'll tell you a little bit. So when it goes to utilization review, because I do some utilization review, a lot of insurance companies will do this sneaky little thing. They'll have an outdated policy based on really old data, and they will get a physician through an independent company to review the policy and make sure that the policy is being followed by the letter. They call it strict policy, like strictly following the policy, even if that specialist knows differently. So if you, and they incentivize it, right? They'll pay these physicians and non-physicians to sign off on reviewing the policy rather than giving a true medical opinion. And that's what's happening here. You got a denial by somebody who's clearly not an MS specialist, who's clearly not a Johns Hopkins MS specialist. And they did it to save the insurance company money. That's why they do it. What does failing a low efficacy treatment mean for you? It means becoming disabled. It means you have a new disability. The relapses in MS are unforgiving. And then and only then can you get the higher efficacy therapy. That is nonsense. And I'm sorry that's happening to you.
Yeah, they're just so frustrating. And we've seen people with the most severe cases of MS. So we know where this can lead without proper treatment. And we hope and pray that doesn't happen to you, Rajat. And it's so frustrating for physicians too. And it's really, the whole process is giving physicians such a bad reputation. It's getting more popular to question physicians and our motives. And we keep trying to explain to people that we're fighting with you and experiencing these same frustrations on a day-to-day basis. We want to try to advocate for you, and that's part of the reason of this podcast, is to help bring some light to some of these issues to people like you that are experiencing these frustrations that's causing all sorts of distrust and anger throughout America and the United States healthcare system. You lead to things like Luigi Mangione. When it first happened, we questioned whether or not he was a physician because, patients will deal with this a couple of times in their life. Physicians deal with these types of obstacles multiple times a day for multiple patients, and it drives us nuts. It really does. So something definitely needs to be done to change the process so that people like you get the treatment that they need sooner. And so again, on behalf of all of us, we're really sorry that you're going through all this. Just out of curiosity, the high intensity treatment that you are trying to pursue, there's some really good ones with MS. Is it Tysabri, which is natalizumab, Ocrevus, which is ocrelizumab, or something new? Because they have a lot of new, really cool medications in MS. And then to follow up, have you worked with the National MS Society? It's a really good organization that has a lot of people with MS, and sometimes some companionship can be really helpful for you to get some guidance and some help you need. And they're a really good organization. Have you reached out to them at all?
I have not. The treatment I was going for was Ocrevus. And I had my reasons why I opted for that versus Tysabri. But I'm definitely interested in the National MS Society. Right now, the only community I have is Reddit MS, and that is the scariest community because every day I get an email and it's just the worst stories, or it's like just someone trolling.
I highly recommend it. I feel like we're telling you some of the worst stories, but there are really good stories too, and that's the nice part about the National MS Society. I mean, they do half marathons and stuff for people that have had MS for decades and people that have been treated appropriately and have taken care of themselves and have really good long-term outcomes. So this is really one of those diseases where your outcome can vary a lot depending on your management and your course. And seeing people with a variety of perspectives and experiences, I think, can be really helpful. So I definitely recommend it.
Yeah, and my employer has a really good community for chronic illness, and I've joined that. But I think the National MS Society sounds like something I would definitely be interested in. So my wife usually takes care of just these community things because for the longest time it was hard for me to accept the diagnosis, and I'm like, I feel fine now. Everything's gone. But then I look at my MRI and I'm like, nope, there's 15 to 20 there. So, but yeah, I'll definitely join it. And this is awesome too. Thank you guys for having me on this podcast. I'll be tuning into these episodes because I'm super interested in neurology now because of my diagnosis, but also just because it's super interesting in general. So I'll definitely be tuning in to future episodes.
Well, thank you so much, Rajjat, for coming on and for sharing your story. It's not easy to be vulnerable in front of a huge crowd and share, a story about your health. So thank you for coming on and doing it. We really appreciate it.
Yeah, sounds good. Thanks, guys. Yeah, again, send me the link. I'll tune in.
Yeah, definitely, Rajat. In a few weeks, we'll maybe even have you back on if you have an update. We'd love to hear from you. And also for our community watching abroad, if you or a loved one is going through a struggle where really you want answers and you want to express your story and to give some credence to exactly what you're feeling, this is a great way to do it. Let us know, reach out to us, comment below, subscribe, and we'd love to talk to you. We'd love to get your story out there. Rajat, I definitely thank you so much for taking the time to talk to us. I definitely would love to have you back on the show anytime.
Sounds good. Thanks, guys.
Thanks, Rajat. All right, Ovi.
Really nice guy. Really nice guy. Yeah.
Amazing. I wish him the best. I can't believe that's happening to him. It could happen to anybody. That's the crazy thing about MS, right?
Yeah, he's lucky to have you as a friend, helping him guide through the process. I've had friends that are in the early stage of MS, and it's just it can be so confusing and scary. So, having someone to talk to about the process is really helpful. So I'm glad he has you at least advocating for him and helping him out.
And I mean, think about this, right? He's in Northern Virginia, right? He's minutes away from Johns Hopkins. He's got the best resources in the world to help him, and he's still 3 months out from getting any therapy. If he is having this kind of trouble, I wonder what the rest of America is going through right now.
Absolutely. I think we know exactly what they're going through. I mean, similar situations are worse on a regular basis. I don't know. It's a broken system. I think everyone knows it's a broken system. No one has the courage to stand up and try to fix it. And that's the real problem.
Well, having said all of that, Ovi, let's dive into the other side of our podcast, which is looking at how technology is changing the future of so many Americans. Do you want me to pull up one of my articles, or do you?
Yeah, I know we have some really cool stuff queued up to be able to discuss. I'm excited to get in it. You go first. We'll trade off. We have basically 2 each. And so, Abhi, you can go first, share an article, and then I'll share mine.
Okay, sweet. So I'll do, I think this one is really quite amazing. So I'm going to pull up this article right here. Give me a second. Okay. So
we talking mice. Let's go.
Now you might remember this from back in the day, doing our peds neurology rotation when we were back in residency. But there's a condition out there, genetically linked, called alternating hemiplegia of childhood.
That's right. I sort of remember that. I went into the adult side of things. What was his name? Dr. McCarty or something like that was an expert on this particular disease, I believe, from Duke.
That's right. One of the smartest people I've ever met in my life. Something about Dr. McCarty and children. He never forgets a child. He took care of thousands and thousands of children his entire career. And you could walk up to him and say a person's name, and he would know every little detail about them.
Just the nicest guy for sure.
Well, I think, this technology is trying to put him out of work.
Good luck. So alternating hemiplegia, I vaguely remember, genetic condition where kids, I mean, it's pretty explanatory in the name, have episodes of weakness, but what does that mean? Give me some detail. Catch me up.
Yeah, absolutely. So you're born with this genetic abnormality. It's at a specific site along your DNA where instead of thinking normally and going about your day, you suddenly have these attacks of paralysis. You cannot move half of your body at a time. And unfortunately, as the disease progresses, there's a high association with seizures. And these are not your mom and pop seizures. These are seizures that are very hard to control and actually shorten your lifespan.
Gosh, pediatric neurology is terrifying. I mean, I have a son now who's 4, and I can't imagine having a child going through one of these conditions or diseases, episodes of weakness, seizures, potential long-term neurological consequences. I can barely handle it when he has a cough. I can't imagine him having a whole full-blown neurological illness.
Well, the good news is the times are a-changing. We are starting to see how modern technology is really going to evolve in our lifetime. These fine folks at MIT and Harvard have just published in Cell a new article that has effectively cured the disease.
Like totally gone, treated? I thought doctors or medicine didn't do cures. We just wanted to do long-term treatments.
Well, these guys are putting us out of business too, I guess, right? That's all I ever want to see is, a child on the floor seizing. That's really why I went into this. So
that's incredible. How did they cure it?
Well, so far, I will have to preface it. They're at the mouse stage, which sounds small because you're like, well, mice aren't humans. But if you can do it at the mouse stage, there's a good chance that you can somehow, maybe in years to come, figure out how to apply it to larger organisms. Mice are not human. We all know that. But to take a mouse that has the same disease as us with the same genetic disorder and give it basically a type of immediate fix through a single injection. That's key. It's single injection therapy once in your lifetime. And it corrects the DNA. It corrects the cells at the DNA level so that these mice no longer have any other seizures, no longer have any other fits. It's quite remarkable.
That's really cool. I remember when we had like a one-time treatment for hepatitis C that came out with Harvoni, and it's so groundbreaking when you can just do one single treatment and you can cure the disease. And for mice, particularly when it's genetic diseases, I feel like it translates well into human experiments and trials. Some of the other diseases that are more chronic, for example, a stroke or a vascular disease, it's really hard for the mouse models to mimic humans, but genetic diseases are a little bit more straightforward in terms of the modeling. So how are they just cut the genes out, put some new ones in? How exactly are they doing it?
Well, I read the paper on Cell, and it's a very advanced technique. It essentially has it's difficult to explain from my level because I'm not the researcher that did it, but they essentially inject this thing that binds to the DNA and goes to the specific site where the mismatch is and then repairs it, connects the two pieces together. And reading the article, it stated that the same area that's being fixed has a very low likelihood of attaching anywhere else. So it's very specifically targeted. And 70% of the cells that are affected by this condition are totally fixed at the end of this one-time procedure in mice. And that translated into a resolution of their symptoms. So even if we don't get 70% Ovi, even if we get some threshold is met where some level of cells are fixed, or hell, maybe we need 2 or 3 injections to make it happen. But I think we're on the right path. I think we're onto something really remarkable where we're using modern day, DNA level changes to fix real harmful deficits. We're seeing less. We want to see less children die at the end of this. That's the goal of everybody.
That's really incredible. A lot of kids are definitely going to be helped by this whole process. I can't wait to see if it translates and they start a human trial. Did the article mention at all if they're initiating one or at that point or still a little bit early?
I think this is hot off the presses. This is new and coming to us live and direct. So we're going to find out over the next coming months to years how this applies. But I mean, at the end of our lifetimes, this might be commonplace.
I thought Harvard lost all its funding. Still seems to be doing some pretty good research. So good work up there in the Boston area. Obviously, a lot of medical innovation comes up from that Boston area. So really, really cool work. And we really hope that it continues to grow and really does well and has the ability to help a lot of kids. As genetic therapies start to grow, this is only going to be one in a number of cases. There's so many diseases that have a genetic basis. And the more we get better at altering and editing genes, the better we're going to be at not treating, but curing genetic diseases. So really excited about this area of medicine moving forward.
Yeah, absolutely. All right, Ovi, lay it on me. You got an article for me?
I want to jump into something a little bit exciting and potentially a touch far-fetched, something that might have some overlap with science fiction, but there are some doctors in the world that are taking it very seriously. What's your reaction to just that heading right there, Abhi?
Well, as a neurologist, unfortunately, this isn't the first time I've seen this claim pop its ugly head. I've seen it in dog models. I've seen it. There's rumors of a billionaire many years ago who tried to live forever by transplanting his head. So I'd love to see where we're at with this. We want to get to Futurama one day.
And so the topic is human head transplants. The title of this article, it's from just a tech website, is Surgeon Claims He's Ready to Do the World's First Ever Human Head Transplant. This article was published in July of this year, and it's about this surgeon that we're familiar with, that we keep seeing his name in the head transplant literature, Dr. Canavero, this Italian neurosurgeon, who says that he's done it in monkeys, dogs. He claims to have done it in human corpses, which is obviously a lot different than doing it in a live human or anything like that. But there's a lot of suspicions about the credibility of his statements. There's a big practical problem when it comes to human head transplants, and that's the spinal cord. Can you reattach it? We can reattach blood vessels. We can reattach skin. We can reattach a lot of the musculoskeletal system around it. But the spinal cord is the big impediment to doing this successfully. People with spinal cord injuries usually have long-term neurological disability. And so we haven't made progress in terms of having a spinal cord reattach or automatically heal up. And that's the big impediment right now. This article even says it sounds something like Frankenstein, but let's suspend reality for a second and just imagine it's possible. You could take someone's head and then take another body, probably someone that's brain dead. So let's imagine a car accident with a severe head injury, so their brain is no longer functional. You can take the first person's head and put it on the body that's healthy to give the first person's head a new body. It sounds like the movie Get Out almost. Is that even ethical? What does that look like? Is that if you were in a situation where your body wasn't working, is that something you would even want?
Ethical, yeah. It doesn't sound like ethics is going to come to this table. I think this is mostly, can we do it? And I think you're right. We can connect the blood vessels. We could connect the fascia. We can probably fuse the cervical vertebrae. But the trick is the spinal cord. And unfortunately, it's not just that when you think about it. It's also what all those nerves are connected to, right? You'd have to have a 1-to-1 pairing where a portion of the spinal cord that connects the arm reconnects to that same arm. It can't be that it connects to the leg or to the diaphragm or something else. How does he propose to resolve that issue? You can't just make the two come together and say kiss.
Yeah, we're definitely not at that level of technology yet. I think that's pretty clear. I know that he's done it in a human cadaver. That doesn't mean too much. That's not a person that's alive. But I don't know what the extent of what he's done it with monkeys or dogs is. But he's been talking about this for a while, and he even had someone that almost participated in it. There was this Russian computer scientist with Wernicke-Hoffmann disease, which is a really bad neurodegenerative condition, similar to ALS. And he was going to give it a try, but then eventually decided he didn't want to proceed with the surgery. But it's kind of tricky if the body donor is an organ donor that's brain dead. Is it as ethical as maybe a heart transplant if you would get it from that same person, or a lung transplant? It's a hard question to answer, but also the amount of immune rejection you would have of the new head and the new body. It would be really hard for your body to maintain that on top. You would probably have to suppress your whole immune system. And so definitely some interesting questions that raise around this. But let's imagine in 100 or 200 years, this could become more common practice if we use advanced technologies to be able to reconnect these nerves. Of course, like you said, there's millions of nerves and they all have to be lined up. So that practically sounds really challenging and difficult. But as long as you keep the brain healthy, maybe you could have a new chance at a healthy body. What do you think? Would you buy in?
Well, I think we're probably at this point closer to a robotic body than we are to a transplant. Even while you're describing this, I'm thinking about all the practical limitations. Within 2 hours of somebody passing away, they enter into a state of rigor mortis. All the muscles are basically locked at that point. How do you propose undoing that? How do you connect all of the sensitive, nerve systems, not just to the spinal cord, but the nerves that connect to the heart, like the vagus nerve? How do you reconnect the diaphragm, like the 3 diaphragmatic nerves? Where's the interface that allows you to control it? I think that it would be simpler, honestly, to keep a head on life support than it would be to reattach it to a whole other body.
I like what you said about robotic bodies maybe coming first. That's already an option for hearts. Like, you can get a heart transplant, or you can have a robotic heart. And that's been going on for a while. It's called an LVAD, a left ventricular assist device that the surgeons can surgically operate on and attach to your heart to help with your heart flow in heart failure. And so we're probably closer to that level of technology, augmenting your body with medical tech rather than giving you a whole fresh new body. But, you're talking about rigor mortis and all that stuff. That's why we really need to do it ideally with someone that's brain dead, which there are not a lot of candidates, but that would be the ideal selection criteria. But the question is, if this technology became usable and accessible, would people take advantage of it? Would you take non-brain dead people? There's already people that steal kidneys and organs and all sorts of stuff out there. Imagine a black market for whole bodies, which is essentially what the movie Get Out was about. That sounds really scary if Elon Musk, as a billionaire, can just buy someone's body that's poor and destitute or in debt and then do something on the black market to get their body. That sounds like a science fiction story I do not want to be in.
I think whatever actually turns out, I'm excited to see what the next decade or so brings out. This might just be another flare up of an overpromise and underdelivery. But with that, let me actually show you something else over here. Let me show you technology that's being used right now to control the body. Ovi, what if I told you that there was technology that surpassed Facebook and Google in its ability to track and know everything about you?
You talking about Instagram?
Yeah, or that paired with TikTok, I guess. No, this is called Liz. It's new tech that's come out that promises to know you inside and out.
Liz is a nice name.
I think that was the whole idea. They were going to make it sound so friendly and welcoming while it tore through everybody's psyche and it got to know them at a very granular level.
So how does she know me?
Well, I don't know if you've been paying attention to the news, but I think AI is on the is on the merge. You've seen more of it. and obviously only for helpful and productive ways, definitely not to control us.
Yeah, we've been reading more and more about AI. It's one of the things we wanted to talk about a lot in this podcast. So I'm glad you brought one in because AI will definitely be changing healthcare and medical technology moving forward. And I'm curious to hear what Liz is going to offer.
Whenever you go to a website, there's obviously the clicks that you select, the keywords that you put in, what pages you go to. But now AI can take that to a much, much deeper level. Liz is technology started by this company called SeedTag. It's already launched. It's available worldwide. And what it essentially does is it tries to understand the consumer's interests and, get this, their emotions.
My emotions? That's scary. The level of data that they have on us now is really, really terrifying. But this just screams privacy issues. It just knows every detail about me and then advertises appropriately or offers me objects. How does it know so much about me?
Well, whereas before they could only analyze when a consumer clicked on a certain, link and followed a tag, they can now watch as you go through an entire page. They look at how long you linger over a link, how long you click through certain topics, and essentially creates a profile of you that looks something like this: a giant network, a web of your interests, and it labels them. Is this person a business person? Is this somebody that's interested in beauty and arts? What are their core fascinations? And then it just keeps feeding it. You see a little bit of it in Instagram, right? You click certain topics and those topics become more prevalent on your feed. Now this is giving information at a much deeper level. Let me ask you this: how many articles do you think that Liz by itself, this one company, how many articles does Liz process in a single day? How many do you think it would do?
That's so scary. Hard to guess. Let's say 1,000, 10,000.
Try 60 million articles, 60 million web pages and user interfaces every single day. And that's just at the start.
So the computers are really watching us. Your search history is no longer private.
I don't know if it's ever been
privacy
private.
back in the day. No longer private whatsoever. So it is watching you and looking at your eyes and where you look on the screen. It's a little bit terrifying. On the flip side, the products it offers me are going to be incredibly accurate, I imagine. Everything that I really need will be right at my fingertips.
Yeah,
But
or you'll get an echo chamber where everything that you think will continue to be reinforced and will continue to divide society until really we just are on our own little camps without any conversation.
every time my wife talks about, feminine undergarments around me, it's going to start popping up on my feed. So it's a question of how accurate this is and how exactly it's going to be deployed. But it's a little bit scary how much they have access to. They almost know us better than we know ourselves. And there's no hiding anymore. There's no privacy. If you think you're doing anything on your screen, on your computer, and you want it to be entirely private, think again, because it probably isn't. But that cloud looks really interesting. And these advanced sort of calculations and processes that AI are capable of are really going to change the world. And I hope everyone's ready for it.
Yeah. And I think all of us are now regretting ever hitting that consent button when we were 12 years old, that my data can be shared, because now we are the product.
It reminds me of that movie Minority Report. I don't know if you've seen it before.
Oh, Tom Cruise?
He walks into a mall and it scans him and his eyes and brings up his history. And it's like, these are the things you need to buy. We're entering that futuristic dystopian world where advertisers are really good and really scary.
Yeah, I think you're absolutely right. So I think we have enough time, Ovi, for one more topic. Do you have another article to share?
Yes, something a little bit more realistic than what I shared last time. So to keep it going with the theme of really cool technology that's going to shape the future of healthcare, and especially because we are neurologists, I wanted to talk about BCI, which are brain-computer interfaces. I'm sure everyone's heard of Neuralink, which is Elon Musk's version of this, but there really are a lot of companies that are pursuing this end, and some people really see it as a key element of healthcare and just technology in general in the future. There's some billionaires that are even saying, hey, I want to wait to have kids until BCI becomes more commonplace because of the way it's just going to change day-to-day life. And so this is an article from Harvard Medical School, kind of summarizing a little bit of the developments that have been going on in the world of BCI. Abhi, have you heard much about BCI? Have you experienced it much in your clinical practice yet?
Yeah, I mean, I love Keanu Reeves. I've seen The Matrix, and I think that, you know, if we can get me to be able to do karate and judo within just a few minutes and save me the pain, then I'll do it. But, you know, is this Hollywood, or is this, you know, actual science?
I think karate and judo for someone like you is definitely serious.
The heck?
That's Hollywood. But being able to do a little bit is definitely becoming realistic. You know, we've had stories of people using BCI that are disabled, and they have the ability to send messages. And if you can send messages to a computer, you can do things like play chess or send text messages, order pizza, whatever you want to do. And it's been going on for a while, you know, since the early 1970s. People have been working on these types of interfaces. And in 2003, our university, Duke University, had implanted some in monkeys and showed that they could control robotic arms. So previously you were saying that, you know, robotic bodies are more the future for people with severe disability, neck down. And this provides credence to that potentially you'll be able to operate mechanical bodies or robot arms or whatnot with BCI equipment if it ever becomes a little bit more practical and cost effective. Because I imagine right now, this is so expensive, it can only be done in the most limited of circumstances. So would you prefer a robotic body to a transplanted head on a human body?
It depends on the body. I mean, if Brad Pitt's offering, I'm not saying no. But anything shy of that, I think I'd have to take the robotic option. You know, I remember seeing articles about Neuralink, and really obviously after their first patient, a few major issues popped up. Lead migration. So is essentially when you have the electrical interface on the brain, and over time those leads move out of position. You can tell that's, I mean, you can kind of logic out that would cause havoc in terms of your inputs and your outputs. Another issue is, you know, making it specific enough for one person without having to reinvent the wheel every single time you implanted a new patient. You really, if you're going to mass produce this or make this available to so many people, it's got to be something that you can plug in, can put in, and have quick feedback. Based on what you've seen, how far are we away from actually getting to the point where I can just go to the doctor and get an implant and then start to receive and send information?
I think we're closer than you think. And a big part about that is because of Neuralink and how forward they've gotten, and they've actually implanted in humans already. Now, it's something that I imagine requires a lot of maintenance just because of the reasons you said. You know, everyone's brain is different. Is it going to migrate? Is there going to be issues with the tech and the software? Is it going to work for 15 minutes and then move, or then have bugs? And there's so much electrical artifact in the human body. You know that as an electrophysiologist. You know, even when you're trying to read blatantly obvious electrical signals from the brain, things like muscles and other stuff can interfere with the message. So I imagine it's not going to be something initially that works consistently well, but I'm hoping with the amount of funding and technology and expertise being invested in this, if they can overcome these problems, because it can really change the game for a lot of our patients.
Yeah, I mean, so talking about it at the structural level, the brain is relatively segmented. You have portions of the brain that control pure motor action. We call that the motor cortex. We have portions where there's motor planning, the executive function. That's the frontal cortex. And it's different for every person. Although you have a general layout of where the arms, the face, the legs may be on the cortex, in one portion of the brain, the actual thinking part, the attention setting, and the relay to that motor cortex is highly variable. Imagine two children growing up, one playing tons of sports and one playing, like you and I, chess team. You know, they're just going to throw a football differently, and that's all the way down to their hardwiring. I just don't know how we're going to overcome those problems, but certainly I would love to hear more updates on this.
Yeah, and I think the sign that there might be good times ahead in this field is that there's multiple companies that are now competing in this space. It's not just Neuralink. There's this company that this article highlights precision neuroscience, started with someone that left Neuralink. And there's a lot of people competing on that end to kind of create the best possible devices. And it might be where it needs to be customizable to specific people.
Yeah.
And so you save it for kind of the sickest patients, the people with, ALS or other severe neurodegenerative diseases. And you kind of do it on a case-per-case basis over time. But you guys are pretty good at mapping the brain. I've seen you guys do it, in particular, the neurophysiologists. So although it can vary from person to person, I feel like you have the ability between fMRI technology and EEG technology to kind of identify where the important parts are for different people, even though it varies, and then to target those areas with the BCI interfaces. But if we can do it consistently, these patients that are bedbound for the rest of their lives because they had a spinal cord injury or severe stroke, or someone like the MS person we talked to earlier, if he has a severe case of MS, it really gives them the opportunity to get a little bit of their level of ability back. If you can now, just with thinking with the functioning parts of your brain, operate certain technology, don't you think?
Yeah. And I mean, right now, I think, in the next decade or two, we might be able to figure out the output side of things, where a portion of the brain is activated and you're able to move an arm, right? We have proof of concept in animal models, but I don't think anybody's really cracked the input side, right? Plugging into the matrix and getting new information in. And a part of that is because we already live in a very efficient collecting model. We have eyes, we have ears, for those that have it functioning, of course, that can take in information really efficiently. So, are we reinventing the wheel a little bit? But we'll see. So Ovi, thank you for sharing that article, and I thank everybody for tuning in. I think it was wonderful to hear Rajjat's story, and really thank him for coming on the show. Again, if you or a loved one is going through something similar, we'd love to hear from you. Comment below, subscribe, talk to us, and who knows, maybe we'll get you on here to share your story.
Yeah, thank you all for listening. Thank you all for being part of the Neuro Bros family. We have to do recurrent podcasts like this where we update you on cool parts of medical technology, meet people in healthcare, either patients or other aspects of the healthcare industry, just to keep you educated and share with you some really interesting parts of the healthcare industry. So please follow along, keep listening to us, join the Neuro Bros family. We're happy to have you. And if there's anything you want us specifically to talk about or mention, just send us a message. Let us know. I'm happy to take a look at that and see what insight we can provide.